Hey there.
Hello.
Hi. So how can a muscle cause eye pain and affect your vision?
Yeah.
Well, that's what we're going to be talking about today. So there's a ton of muscles that are in the neck area and in the head that can create headaches and eye pain, ear pain, teeth pain, right? And face pain. And so we're not going to be covering all those muscles today because there's way too many.
Yeah.
But today we're going to talk about one muscle, and that is the Splenius Cervicis right here. It's orange on Mr. Manny. So we're going to be sharing information about this muscle, how it can create that pain, and self-care that you can start right now to make this muscle happy.
Absolutely.
So hey, this is Brian and Christina from Your HealthySteps, the creators of the Ultimate Foam Roller Blueprint. And we teach purposeful foam rolling and self-care skills so you can be active and pain-free.
Absolutely.
So this is for educational purposes only. We are sharing with you 15 years of our experience as neuromuscular massage therapists.
And it's interesting that throughout the body there are muscles that can have pain patterns or create issues in areas that they're not even located in. And Splenius cervicis is certainly one of those. And we've had a lot of clients come in and said, you know, I have a pain in my eye or pain in my ear, and I've had it checked out. Maybe I had this deep aching in my head. And it turns out it's, you know, everything else is good, and then this muscle is the issue. So a lot of times it's the muscle's not located where the pain is at. It's very interesting. So let's go with location right off the bat. So Splenius cervicis is on the back of your neck. It's on the back of your neck. It comes out of the cervical of the spine just below the top of your shoulder blade. So just below the top of your shoulder blades, it's coming out of that spine, runs all the way up the back of your neck, and then attaches into the upper parts of the side of the cervical spine, right up in here. So that's the location of Splenius cervicis. And then Christina's going to sort of show you how you can find it on yourself. It's a very difficult muscle to find.
Right. Okay, so there's a lot of muscles back here. So
Absolutely.
for us to just say, put your hand over here and you can feel it, just that muscle, is impossible. But if you want to get to the general idea, this is where it is.
Yeah.
So if you put your fingers on your spine and you feel that there's a larger bump here on your spinous process, just slide down one and then move on over, and here it is. It's alongside your spine.
Yep.
That's the attachments here. And then as you move your hand up, you'll feel the rest of the muscle, and it goes all the way up to the top of your spine, not onto your scalp yet, right here.
Just right to the bottom of the skull.
So that's
basically
the general area.
So what does this muscle do? Well, its main job, because it's sitting back here in the back of your neck, is to pull your head up, or pull your head and neck backwards. We call that extension. So it's just pulling the head back, head and neck back. And when it's working together, and when it's working separately, it causes the head to rotate. So if one muscle is firing, it will cause your head to rotate to one side or the other, to the other direction. If it's working together, it'll pull the head backwards. Okay. Now, what are some of the pain patterns for this muscle? So when muscle gets very, very tight, it can create hyper-irritated points, and then they become tender points, which is localized pain, and then they become trigger points, which become much more broad pattern pain. And this muscle can develop two common trigger points. And so I'm going to turn Mr. Manny around here. The trigger points are fairly high up in this muscle. The top one basically sends pain to behind the ear on the neck, just below the skull and the ear, behind the ear but up on the skull, to on top of the ear, down into your temple, all the way across the temple, and just into the side of your eye. And so the pain can actually come into this side of the eye. And this trigger point can actually cause blurred vision. So again, not only is it creating pain, but it can actually impact the vision of your eye. Now the lower trigger point sends pain more into the side of the neck, where the neck and the shoulder come together, and down into the shoulder. So again, these pain patterns are not anywhere remotely located to where this muscle is. Very interesting. And then some of the other problems that this muscle can do when it's tight, if both of them are tight, it's going to put strain on the back of the neck, right back in the back of the base of the skull. And if one of them is overly tight, it's actually going to pull that vertebrae as it tries to force your head into rotation, as it tries to rotate the head around. So again, it's putting strain on the vertebrae of your neck, and in time that can just create wear and tear.
Right, yeah. Okay, so what causes this muscle to be tight?
Absolutely.
And Brian pretty much alluded to it, that it's poor posture.
Yep.
And if you think about where this muscle is located, and you think about how much time we spend on the cell phone or working on our computer, you can see why this muscle is just being stretched and working so hard to keep our head from falling forward, right?
Trying to get it to pull back up,
holding that head. Yeah. So that's what causes this muscle to be tight.
So some of the self-care you can do with this. Now, when we're dealing with the neck and we're talking about self-care, we want to make sure that you check in with your chiropractor, with your doctor, and PT, so that you know that this is a healthy, good, solid, healthy bone structure in the neck, so we don't have any problems. Okay, it's really important that you do that. But 2 tennis balls and a sock is really good here, because then the vertebrae is in between, and these muscles are the tennis balls are just working on the muscle on either side.
Or the myofascial balls.
Or the myofascial balls, yes. And they tend to be a little bit hard, so we want you to start off nice and easy with the tennis balls, then move to the myofascial balls. And that's kind of nice, because then the spine is right between both of those balls. But sometimes that might be a bit tender, so you can start off with a foam roller. But again, the vertebrae would be right on the foam roller, so again, that's something that you need to have checked out first before you can do that. And then once you've worked this out really nicely, then a gentle stretching is always good. You can stretch by rotating your head, tilting the head back, and then stretching the head forward, and that'll help loosen up this muscle.
You got it. And then of course, always, if you're working on yourself and it's way too tender, go to your therapist, go to a massage therapist, go to your PT and get some help. Go to your chiropractor, get some help.
Yeah, don't feel like you have to tear it out. If it's really tender, then it's probably a good bet to have a professional get in and work on it. Yep.
Yes. So if you are the kind of person who wants to take an active role in your self-care,
absolutely,
then you will totally appreciate and benefit this new program that we have just created. It's called the First 3 Steps to a More Flexible and Pain-Free Body.
Absolutely.
And it's actually a 9-day program that you work on at your own pace.
Yeah.
And so I'll put it in the comments below, and I'm excited for you to try it.
Absolutely. Yep. It'll do some really good stuff.
Okay, and if you found this to be helpful, please give us a like.
Yeah.
If you know somebody who is dealing with chronic neck pain or is having some of those unusual referrals we just discussed, please share this with them. This could be their solution to finding relief.
It's been that way for quite a few of our clients who couldn't figure out what was going on, and we were able to get it loosened up, so that's good.
Yes, because our goal is to help you to be pain-free.
Yeah.
Okay. All done?
All done.
Okay, great, thanks. We'll
right.
see you later.
Have
This is
a great
Brian
day.
and Christina from Your Healthy Steps. Bye-bye.
Bye-bye.